Hello, my name is Haley Wingo, and I'm here to answer questions for audiology. Just a brief overview. I'm just going to do a brief little overview what the questions are and then give my full answer. So the first thing that we're looking at is Mrs. S complaining of no pain in the right ear, but definitely noticing that there is a decline. The doctor didn't notice anything on the initial exam. We're just looking at that audiogram and word recognition system, and just seeing how those things add up. So the first question about what the three frequencies are for the right and left ear, and we're looking at the pure tone average, and the pure tone average is done by doing 500, 1000, and 2000 hertz, and by looking at those scores, adding them all together and averaging those out. So for the left ear, it has a 16.7 pure tone average, and that is actually pretty good. Really, we just want that number to be less than 25, whereas the right ear has a 28.3 pure tone average. So that is obviously saying that there is something definitely wrong with this ear. Which is aligning with the audiogram and also the patient report. The next is identify the type and degree of loss in each ear and whether or not those align with the doctor's overview of the patient and also the patient's report of themselves. So the patient definitely has severe hearing loss on that right ear, and it looks to be sensory neural hearing loss, and that does match up with the patient's report because they weren't complaining of any pain. And sensory neural is an inner ear issue, and typically with sensory neural, we don't see pain typically. There are a few exceptions, but that is typically the case with sensory neural hearing loss. Also, this does absolutely align with the doctor's report because when doing an exam where you're just looking at the ear and looking at that middle and outer ear canal, well, since this is an inner ear issue, absolutely the doctor would not have seen anything going on with that right ear. With the left ear, there seems to be sensory neural hearing loss, and it is mild loss. And this also would align with the doctor's reports. However, there really isn't much given with the patient's history. So, sensory neural is the most logical answer. However, because there really isn't a lot of backstory on that left ear, it is not definitive compared to the right ear, which we are given more information on. We're simply just going on the pattern that is displaying on the audiogram, where it is just a slope. So the next question is based on the sprint chart. Is the patient's WRS what we would expect with patient hearing loss? And absolutely, the patient's hearing loss on the left ear, the level is slightly difficult. And since this is a mild hearing loss, slightly difficult for a WRS score, absolutely matches as far as their wording in front of the meaning, just saying there is just a slight difficulty there, but overall not a severe loss. And with the score on the right ear is very poor recognition, which absolutely would match severe hearing loss because both of those are saying this is something that is extremely troubling. So that absolutely would match up with severe hearing loss and mild hearing loss. And the next question is based on the patient's report and the observation and the audiometric findings. What type of tympanogram results would you expect in each ear? So I really would expect to have a type A normal ear exam as far as that, because this exam only measures pressure and feedback based on those vibrations from the eardrum, and it really just observes the middle ear. And since there's nothing wrong with that middle ear and the eardrum, those pressures are going to read typically normal. And really, the whole point of that examination is really just to see if there's a middle ear issue. It's more to rule out things or to lead the doctor to what area they're looking at. So I think those observations would come back type A, completely normal, because we're not dealing with a middle ear issue. So the next question of when looking at information provided by the patient, are there any auditory disorders that would possibly match with the patient's report? There is one that it is possibly autoimmune inner ear disease, and this matches up because the symptoms given by the patient are tinnitus and oral fullness, or just meaning like your ear feels full. And those are actually very common with autoimmune inner ear disease. And so those things matching up, and also the lack of other symptoms, no pain, also no any other obviously notable symptoms, this would probably match with the patient. I would definitely say that could be the direction that this patient is heading. So the next observation question is, as an audiologist, your adult patient asks why there are different prices between you and the audiology department, and why somebody who is a hearing aid dispenser or a hearing instrumentalist specialist is less expensive than you are when it comes to getting a hearing aid, and how you would explain those differences. And really, the main difference would come down to the education. While a hearing instrument specialist are not even required to go to school in some states do require 2 years, but overall, their main job is just training. While they can do an hearing examination just to tell you if you have hearing loss whatsoever, they can't tell you exactly what is going on, what type of hearing loss, why is this hearing loss happening? And that absolutely would affect what type of hearing aid a person needed, because with different issues comes different needs. And hearing aids typically can have some difference as far as what kind of issues you're having or how severe it is, that would typically lead an audiologist to point to a specific hearing aid. So an audiologist has many, many years of experience. They have to go to school for 6 to 8 years. And so their knowledge of that subject is far greater. Also, fitting that hearing aid. Mainly when getting a hearing aid, you want to make sure that that hearing aid is fitted properly to the ear, and an audiologist can do that for a patient compared to a hearing aid dispenser or hearing instrument specialist who isn't really knowledgeable on that and can't make the patient have just as much quality from their hearing aid as possible. So those things are naturally going to make the prices a little bit more expensive because of all the extra things you're getting as far as the knowledge, as far as what type of hearing aid you need, and also fitting that hearing aid that is most beneficial to the patient is really the key indicators for why an audiologist might be a little bit more pricey than a hearing instrument specialist, just because of the quality that you're getting. So that's why it is more important to see an audiologist rather than a hearing instrument specialist when it comes to actual hearing loss. So the next question, a 4-month-old patient has been diagnosed with severe profound sensory neural hearing loss, and basically explaining the possible communication methods between the parents and their child. What are their options? And really, there are three different options here. First would be to not go forward with a cochlear implant and to just do American Sign Language or ASL. This is a very good option for some people. People do tend to like ASL. It can be just as full and rich as any other language. So if they, both parents were to commit to that and learn ASL and to teach their child that, their child can develop a good form of language. However, that is limiting to them as far as living in a hearing world, so that does need to be taken into consideration as well. And while the second option is at the age of 10 months when a cochlear implant is possible, would be to get that implantation done. And typically, if it's done at 10 months old, speech will develop after that at a pretty normal rate, maybe a slight speech delay just because of 10 months of not hearing, but typically speech will develop and that child will be able to learn communication through speech. However, the third option shows that these two options aren't mutually exclusive. You can absolutely get a cochlear implant for this child and teach them American Sign Language to enrich them with deaf culture and give them that form of communication with people that they can relate to, and also give them a cochlear implant at the same time, allowing them to communicate better with the hearing world. So there are three good options that a parent can choose from as far as communication with that child. So the next observation or next question is, Marnie at age 4 has some hearing loss from meningitis. Her mother is not sending her to pre-K with her hearing aids on, and because she believes that kids are teasing her, and because when she is talking to Marnie, she hears just fine. And the question of how these comments, what issues are these comments suggesting, and how would you approach dealing with the issue? So, the issues these comments are having is the fact that the mother isn't truly understanding the implications of what can happen when, a person with hearing loss is speaking to somebody one on one, right next to somebody. Naturally, that's going to be much easier for Marnie. But in a loud classroom with multiple different noises going on, and also with a fair distance away from the teacher, there is a really good possibility that Marnie is losing what the teacher is saying. And so that definitely is going to be poor for quality of life as far as education. So that's definitely a huge issue for Marnie, and something that her mother's not really getting. The way that I would approach this is through three different options. And really, it's the first just to explain what is going on to the mother and explain the importance and see if she will then agree to put Marnie back onto the hearing aids when she goes into school. The second option would also be to go in and talk to the kids in her class. So that way, Marnie's mom will feel that this issue is taken care of, especially as the school's audiologist going into the classroom explaining how to be kind to Marnie and understanding what is going on with Marnie to her peers might handle that situation, see if that is something that needs to be discussed with the school or with certain kids, and bringing that up. The third option would be if neither of those options are viable to Marnie's mom or to the school, would be to possibly find another type of hearing aid that is more discreet for Marnie that would work with her hearing loss. And out of all these three options, I would say that number three probably is going to be an option that a mom like this might lean to, just because if they are caring about the way their child is presenting, maybe opting for a more discreet hearing aid may be the most viable option for them. So the next question is, um, looking at a patient's history. The reason he's here is because his wife thinks he has a hearing problem. He doesn't think he has one. His main complaint is that he thinks people are mumbling more than they used to nowadays. Also, when calling his name, he didn't respond. And how would I approach this patient? And how would I lean this patient towards accepting and amplifying his sound with a hearing aid? So, the main thing I would first do is listen to what he has to say and then maybe just be as calm and reassuring to him and go, okay, well, since you're here, let's go do an examination. And also, when doing the interview with him, just try to be as calm and collected as possible. Don't try to make him too concerned with the questions, and just leave, the space for him to express himself without too many negative reactions of if he says something that obviously shows some hearing loss. To not have too much of a reaction. And then once all the interviews and the examinations are done, would be to sit down and very calmly explain his issues to him, and also explain how a hearing aid could really benefit his life, and also reassuring him that this is a very common issue with somebody his age, and doing those reassurances to him and making it seem like a hearing aid is just no big deal, that a hearing aid is a very quick fix for him in a sense, and a very easy fix for his life, and that he'll have a much better quality of life, and it's nothing too concerning, something too drastic, just something that can be easily done at the clinic. And hopefully, with that attitude and the simple explanation, and just being as rational and clear as possible when explaining his condition to him, hopefully that would lean him towards getting a hearing aid. Thank you so much for listening to me. I hope this has been very informative. Thank you so, so much.